Welcome to our comprehensive guide on dental implant components. In this video, we'll break down the essential parts that make up a dental implant system, explaining their functions and how they work together to restore oral health. Whether you're a dental professional or simply curious about the process, understanding these components is key to appreciating the complexity and precision behind modern dental implants. Let's start by exploring the foundation of the system and gradually move through each critical part, ensuring you gain a clear and structured overview. The implant body, also known as the fixture screw, is the portion of the implant system that is surgically placed within the bone. This component acts as the root of the artificial tooth, providing a stable and durable foundation for all subsequent parts. Its design and material are crucial for successful osseointegration, which is the process where the bone fuses with the implant. Without a properly integrated implant body, the entire restoration would lack stability and longevity. After the implant body is placed, a cover screw, sometimes called a sealing or healing screw, is used to seal the occlusal surface of the implant. This is a critical step during osseointegration, as the cover screw prevents tissue from growing over or into the implant. By maintaining a clean and protected environment, the cover screw ensures that the implant remains accessible for the next stage of treatment. Once the implant is successfully integrated with the bone, the healing abutment, also known as the healing collar or cap, is attached. This dome-shaped screw maintains the opening through the gum tissue, allowing for proper healing and shaping of the soft tissue. Healing abutments come in various lengths, typically ranging from 2 mm to 10 mm, to accommodate different clinical situations and tissue thicknesses. The healing cap, sometimes referred to as a comfort cap or temporary screw, is placed on top of the transmucosal abutment. Its primary role is to protect the internal threads and interface surfaces of the abutment during the healing phase. By shielding these critical areas, the healing cap ensures that the abutment remains uncontaminated and ready for the final restoration. The standard abutment, also known as the tissue or permucosal extension, acts as an intermediate component between the implant and the final restoration. It provides essential support and retention for fixed or removable prostheses. The abutment's design allows for a secure connection, ensuring that the restoration remains stable during function. A tapered or conical abutment serves a similar function to the standard abutment, but features a conical shape. This design can offer improved support and aesthetics, especially in cases where the restoration requires a more natural emergence profile. The tapered abutment is also placed between the implant and the final restoration, ensuring a secure and functional connection. The hex driver, sometimes called a hex tool or screwdriver, is a vital instrument in implant dentistry. It is used for placing and removing all hex screws, including abutment fastening screws, impression posts, and healing abutments. Hex drivers are available in different lengths, with shorter versions for posterior teeth and longer ones for anterior placements, ensuring accessibility in all areas of the mouth. The abutment driver, also known as a seating tool, is specifically designed to seat abutments directly into implants. This tool ensures that abutments are positioned accurately and securely, which is critical for the long-term success of the restoration. Proper seating prevents complications and guarantees a stable foundation for the prosthesis. The impression post, also called an impression pin or coping, is used during the impression procedure to transfer the intraoral position of the implant to a dental cast. This step is crucial for fabricating a prosthesis that fits precisely. By accurately capturing the implant's position, the impression post ensures that the final restoration will align perfectly with the patient's anatomy. A laboratory analog, also known as an implant or abutment analog, is a replica of the actual implant used in the dental laboratory. It is embedded in the working cast to simulate the patient's mouth, allowing technicians to fabricate an implant-supported prosthesis with high accuracy. This component is essential for ensuring that the final restoration fits the clinical situation precisely. Temporary copings, also known as provisional abutments or cylinders, provide support and retention for temporary or provisional restorations. These components are used during the interim phase, allowing patients to maintain function and aesthetics while the final prosthesis is being fabricated. Temporary copings are designed for easy removal and replacement. A fixed abutment, sometimes called a straight or coping abutment, is used for cement-retained restorations. These abutments are available in various angulations, such as 15 degrees and 25 degrees, to accommodate different clinical needs. They provide a stable base for the final crown or bridge, ensuring a secure and long-lasting result. The plastic sleeve, also known as a waxing sleeve or castable coping, is a castable wax pattern used during the laboratory waxing procedure. It helps form a custom abutment tailored to the patient's specific needs. This component is essential for creating individualized solutions in complex restorative cases. A gold cylinder, also called a gold sleeve or coping, is a pre-machined abutment that is waxed and cast directly onto the transmucosal abutment. Gold cylinders provide a precise fit and are often used in high-end restorative cases where accuracy and longevity are paramount. The prosthesis retaining screw, also known as a coping screw, is used to secure a screw-retained metal bar framework or restoration onto transmucosal abutments. This component is critical for the stability and retention of the final prosthesis, especially in cases where a removable or fixed bar is used. Impression posts and sleeves, such as the 2 mm titanium impression post and plastic sleeve, are used together during the impression procedure. The post is attached to the implant, while the sleeve helps capture the precise position and orientation. This combination is vital for transferring accurate information to the dental laboratory. The universal ratchet, or torque wrench, is a specialized tool used for torquing the implant and abutment. It allows clinicians to apply precise force, typically ranging from 10 to 45 NCM, ensuring that components are securely fastened without risk of over-tightening or damage. Proper torque is essential for the longevity and stability of the implant system. Let's visualize the relationship between the main implant components in a schematic diagram. This overview helps clarify how each part fits together, from the implant body in the bone to the prosthesis on top. Understanding this structure is essential for grasping the workflow of implant-supported restorations. A central concept in implant dentistry is osseointegration, the process by which the bone fuses with the implant body. This biological phenomenon is critical for the long-term success and stability of dental implants. Without proper osseointegration, the implant cannot support the forces of chewing and may fail prematurely. In summary, each component of the dental implant system plays a unique and vital role, from the implant body anchoring in the bone to the prosthesis restoring function and aesthetics. Understanding these parts and their functions is essential for clinicians and patients alike. The clinical workflow involves careful planning, precise placement, and the use of specialized tools and components to achieve a successful outcome. With advances in technology and materials, dental implants continue to offer reliable and life-changing solutions for tooth replacement.